Welcome back. Delighted to have you here to talk more about developing your practice through the promotion of interdisciplinary care at the intersection of faith and neuroscience. Now we come to the third section on page 2 of the Clinical Interpretation Report dealing with sleep disturbance. The NIH Sleep Disturbance Scale results are presented here. This is based on the scores from item 17 through 24 with item responses on page 1 of the CPA report. This section starts with a definition of sleep disturbance that's based on the DSM-5. This is actually called Sleep-Wake Disorders in the DSM-5. As I take a look at my caseload, many people come in with sleep disturbance. Sleep disturbance is a problem with anxiety and depression, and it's also a typical problem for people who've had brain injuries, which is one of my specialties. A focus on sleep disturbance is a terrific way to build your practice. I've developed an approach to this called Brain-Restorative sleep that I'd like to share with you briefly. BRS is a faith-based approach to cognitive behavioral therapy for sleep-wake disorders. BRS is crucial for my brain damaged clients because it's brain protective. We're still sorting this out, but a process called glymphatic clearance may postpone the onset of dementia. Concussions are a major risk factor for dementia, which really worries my clients. It turns out that glymphatic clearance takes place during deep sleep. Check this out by looking in Google Scholar or PubMed for more information. For people who don't have brain damage or a concussion, BRS enhances brain health and brain fitness. Healthy adults need 4 sleep cycles for brain maintenance and 5 sleep cycles for brain restoration. Now, I've got an extremely busy week, so I have to be intentional about having 2 5-sleep cycle days and always getting at least 4 sleep cycles. With my wife's help and understanding, I usually accomplish this, but that's a topic for another video. There's something special about treating sleep disturbance. This section of the CPA report helps me get beyond treating only psychopathology. Of course, psychopathology is our primary focus, but it's absolutely fantastic to sustain relationships with my clients beyond psychopathology as they move into dealing with personal growth. And a key component of personal growth is brain restorative sleep. During sleep, a process called Neuro Consolidation occurs. Neuro Consolidation takes place every minute of every day, but sleep is when the most complex Neuro Consolidation occurs. Until recently, we didn't understand that we can guide Neuro Consolidation as we sleep. I personally take advantage of this, and my clients do as well. The hippocampus is where cognitive information comes into the brain and is stored temporarily. By temporary storage, I mean a matter of minutes to a few hours. A very small percentage of that information is neuroconsolidated into long-term memories. The information that moves from the hippocampus and throughout the brain to make long-term memories has 2 characteristics. First, it has high emotional salience. Whenever emotions are tied to cognitive input, that input tends to be neuroconsolidated into long-term memories. That's what happens with PTSD. It also is what happened to you when you had your first romantic kiss all those years ago. Emotional salience can be either positive or negative. The second characteristic of information that becomes long-term memories is that it's not got much competition while it's in the hippocampus. If a lot of information is coming in during a very busy day, information that's only moderately important tends to get lost. We also tend to make negative information into long-term memories more often than positive information. I won't go into all the details here, but most people in our competitive society feel threats to their competence. Those threats put negative emotional salience on information that is only moderately important. I work with my clients on this all the time. One of the tools that we use often is called the healthy hippocampus exercise. For people who have problems with depression, it's a little different, and I call it the happy hippocampus exercise. Both processes use brain restorative sleep, the same tools that I use to help people with sleep disturbance. This is a widespread problem, and there's currently a serious shortage of practitioners. As a consequence, brain restorative sleep is a great opportunity for practice development. This map is based on a federal study of inadequate sleep in 2014. While there are parts of the country that don't seem to be impacted, Southern Nevada, Appalachia, and the Deep South seem to have serious problems with inadequate sleep. One of the issues here is that inadequate sleep isn't readily acknowledged. I have a lot of my clients tell me, I only need 5 hours sleep each night, which completely defies all of the science about sleep and brain health. I've had other clients tell me, I don't have a problem with sleep. I fall asleep as soon as my head hits the pillow. When I hear this, my response is usually something like, I'm sorry that you're so exhausted. Would you be interested in sleeping smarter so that you don't have to work so hard? Of course, this brings about puzzlement in my client, but it starts a conversation that many people respond to very positively. Sleeping smarter rather than working harder is a welcome trade-off. Another important issue is that men can be very reluctant to admit problems with anxiety or depression, but they're much more likely to admit that they have problems with sleep. It just doesn't have as much stigma. This leads to a better male-to-female balance in your practice. A focus on sleep helps me get more men into my practice. Once a man feels comfortable with me, he's much more likely to refer his spouse and children and friends. There's a lot of leverage to be gained by being intentional about seeking men as clients. Men also tend to have more of the jobs that place them at risk when they have insomnia. Some of the more enlightened companies are now including treatment for insomnia in their employee assistance programs. Treatment for sleep disturbance is readily reimbursable. Even if you don't accept insurance, many of your clients can get out-of-network reimbursement for your services. However, they need to have an appropriate diagnosis and receive appropriate services. Another issue to keep in mind is the packaged and results-oriented nature of BRS. It's fairly easy to specify how quickly the person is going to be able to benefit, typically around 6 sessions and rarely more than 8 or 9. This lets people budget for your services. It also helps people shop for your services. Many people don't want to get involved with psychotherapy because they've heard how expensive it is. The cost-benefit ratio tends to be poor because we don't handle this issue very well. In fact, BRS and generally treatment for sleep-wake disturbance has a great cost-benefit ratio. And finally, insomnia is a very important growth area for physicians. As our society ages and puts on weight, sleep-wake disturbances become much more prevalent. Physicians are seeking trustworthy and knowledgeable referral sources to help them go beyond just the use of medication. So thanks for your attention. Please remember that we've got a free trial of the CPA. If you're a licensed counselor, psychologist, or clinical social worker, we provide a free trial and also free trial to provisionally licensed folks. We also support clinical internship and residency programs. Contact us and let us know how we can help. Thanks again.